Dr. Houry, welcome. Thanks for joining us.
My pleasure. Thanks for having me.
It's been quite a few weeks for you, to say the least, and I think probably capping it with the hearing today with RFK Jr. On the Hill. I'm sure you were watching alongside many Americans. What has been your thinking in watching the back and forth so far?
The hearing was really something else, and many things struck me, including, initially he said he didn't know anything about the number of COVID deaths because he doesn't know the data. And you think as secretary, you'd want to hear from your senior career scientists. And I can tell you, I briefed prior secretaries such as Price and Azar and Becerra, but did not have the opportunity with this secretary. So that struck me. I think another thing that really stood out to me was he kept talking about his focus on chronic disease and wanting to make America healthy again. That's certainly laudable, but in the president's budget, almost the entire chronic disease center is wiped out. So that's just not true either.
You talk about briefings. You have been at the CDC since 2014, as you mentioned. You are no longer there because you quit. Normally, would HHS secretaries be taking briefings from you on a daily basis, on a weekly basis, and how did that compare to what you've been dealing with RFK?
So it really varies on the circumstance. Some, health secretaries would want the leadership team to brief on a monthly basis, and if it was certainly a crisis or an outbreak, that would be much more regular. So I thought during the measles outbreak, when we have set the record for measles cases, in the U.S. in 30 years, that would be a good time to brief the secretary on measles and prevention. And we offered that, and it was not accepted as an offer. But in the usual circumstance, we would have been having more regular briefings. And we did in prior administrations, on like H5N1, certainly COVID.
What has been the mood like inside the CDC since RFK Jr. Took office, especially when it comes to the worry surrounding misinformation and what is being put out there?
So I was actually the transition lead for the agency. And so I had read RFK's books and was aware of his priorities and had really briefed our staff and had them come together around how we could work with the secretary on his priorities. So we were optimistic and willing to have change. But when he talks about measles vaccines and says things like there's fetal parts in them, or after the shooting, he said, don't trust the experts. That type of misinformation certainly decreases morale at the agency. And it's very hard for us to message to the public when the health secretary is saying things in contrast to what we are saying.
When you say open to change, where do you think there was a point in which the CDC needed change? What were areas in which you felt as if RFK Jr. and his kind of goals lined up with the potential changes that needed to happen at the CDC?
Yeah, and I'll even take a step back further. So, during COVID, there were missteps and we learned a lot. And so since then, data became much more timely. We posted dashboards. We were tracking things differently. We also addressed lab quality and as well as readiness of our staff to ensure that if there was an outbreak, they were trained and knew how to respond. So over the past few years, we had tried to address many of those issues. Under, the secretary, he had a significant interest in big data and artificial intelligence. To us, that was exciting to look at new data sets and new ways to analyze data. He also wanted to ask tough questions. That's what we do in science, but you shouldn't know the answer before you ask the question. And we saw that, and sometimes it seemed like the administration was trying to retrofit answers into the data.
Dr. Monarez actually wrote an op-ed in the Wall Street Journal today that before she was fired, she was told to pre-approve recommendations that came from a vaccine advisory panel made up of vaccine skeptics. At the hearing today, Secretary RFK Jr. denied that actually happened. He, in fact, went on the record at this hearing and said, she lied. Were you there for that conversation? Do you have any knowledge as to what actually happened in that exchange?
I was not there for that meeting, but I did speak to her afterwards, and she was very upset and had relayed exactly that he had wanted her to rubber stamp recommendations. And she has said from the beginning that science and data are her North Star. And that's why I wanted to work for and with her, because same thing. We are open to change and to asking tough questions, but you have to let science and data drive that.
A lot of folks would then say, well, Dr. Houry, Dr. Monarez, why would you even continue to work for an administration that is leading with an HHS secretary like RFK Jr., who has been a notable and outspoken vaccine skeptic from the jump.
Yeah, and what I would say is I did what I could, for as long as I could. I think everybody has the right to question vaccines and if it's right for them. But when we have good science and data that show that vaccines are protective, we need to lean into that more. For me, over the past few months, it became more difficult to work as I saw many of these issues around scientific integrity, like having to take a transparent document down on thimerosal and additive and flu vaccines. That was wrong.
Wait, explain that again. So, because, remember who you're speaking to,
Yeah.
Dr. Houry.
So at the last vaccine committee meeting, there was a presentation on this additive that's in flu vaccines. It's called thimerosal. About 20 years ago, there was a concern that it could cause autism. And There's been many studies since then that have shown that it doesn't. But it was brought up for vote at this committee meeting. And our staff had pulled together just an evidence review of thimerosal and posted it on the website. And the secretary's office ordered it down and had a person, Lynn Redwood, who came from the Children's Health Defense, to talk about thimerosal. And that presentation had not been vetted or cleared by CDC and actually included references that didn't exist. And to me, that was really compromising our scientific integrity, both to remove a document and to have an unvetted presentation go forward under a CDC committee. Things like that over time, I just couldn't be there anymore for that.
Oftentimes, the CDC is allowed to remain apolitical amidst the changeover in administrations. Some wonder as they see the changes that are happening at the CDC and under Health Secretary RFK Jr. as to whether or not these changes can be reversed. Can it be?
I hope so. That's one of the reasons why, Dan, Dimitri, and I resigned together to really sound the alarm. I've been calling it a bat signal. And for me, it's just a different HHS leadership group. It's not a different administration. CDC did well under President Trump previously. And so I think it's really about a different leadership at the Health and Human Services Department that is needed. It's not going to happen overnight with the damage that's been done, but I am very hopeful that CDC and public health in our country can still thrive if we intervene now.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.